We'll start our round of questioning. We will have time for one round of question, and we will go over somewhat the hour. We start with Ms. Rempel Garner. 6 minutes, please.
Thank you, Chair. To Dr. Poon, how many of your members do you think can afford to take the 2-week quarantine period to reunite with their loved one?
We are thankful that the Government of Canada has allowed family reunification to occur, although much later than we expected. The question is, though, how many of them can afford not only the 2-week quarantine once they arrive in Canada, as well as the 2-week quarantine back when they go to their home country. Now, this is not to be disparaging and to be flippant about the health and safety of Canadians. There must be a safe pathway to do so. That is why in our recommendations, we believe that there must be an inquiry to alternatives to
Dr.
the 14.
Poon, my 6 minutes is going to go really quick. So I'm just wondering, I'm just wondering, do you think many of your members can afford that 2-week quarantine?
No, they cannot.
Yeah. Look, this is probably the first time I've ever done this in my time in Parliament, but I'll just get personal for a second. I didn't expect a tall, dark, and handsome American to come into my life. I'm glad he did. But even in my position of privilege, you know, it was over 5 months that I was separated from my husband this year, and it was only because of the Alberta pilot project that we were able to see each other. And it's really hard. It's really hard. I don't get to see my kids. I don't get to see my mother-in-law who has stage 4 breast cancer, and it's hard. And this is me as a legislator sitting in this committee right now, and you guys, everyone on this committee knows I'm tough as nails, and you know, I know some of the names the Liberals call me, but every night when I come home alone, it's hard, and this is me. So I'm just wondering that if there are alternatives to quarantine that have better public health outcomes, like if we could test everyone at the airport as opposed to letting 4 million people come in untested who may or may not observe the quarantine. I know there's quarantine exceptions for that many people over the last several months. I'm just wondering, given that you're a clinician, Dr. Poon, if part of your recommendation is to expand systems like we're seeing in Alberta to other airports and other border crossings across the country so that it can aid in family reunification.
The system in Alberta, along with the pilot in British Columbia for airport testing, along with the pilot in Ontario for airport testing, will offer wonderful ways to increase the number of reunited families, particularly if we apply what's being used in airports to the land borders, which should be helpful. Once again, we are not asking for open borders. We are just asking to be together, and we want to be together safely.
Yeah, I hear you. I guess I wanted to explore a little bit more about your recommendations around family reunification for compassionate visits. I know I was particularly moved by a case in Manitoba recently where after months of begging and procedural work, somebody was granted an exemption to come into Canada to see a family member who was in the hospital, but then couldn't reunite with them before they passed because there was no exemption to quarantine, even if a test was administered. Are there other countries around the world that are doing this that we should be looking to for best practice?
So there are many countries in the world without particular border standards, restrictions that Canada has. The compassionate exemptions have been worked in through different family reunification on a case-by-case basis in other countries. For example, in the US, you can actually just fly over right now to see a loved one who might be passing away. Donna's rule, which I'm suggesting, must be a federal government mandate to prioritize family reunification in the times of crisis, because we must not.
I think we lost you, Dr. Poon.
Dr. Poon, you're muted.
We cannot have families say goodbye to their mother when she's dying through FaceTime. There must be, Donna's rule, to prioritize family unification at a time of crisis.
I think personal stories are important right now. You're a clinician. Can you summarize what it's like on behalf of everyone in your group, as well as your experience, what it's like to be separated from your loved one for over half a year, for months at a time.
I asked members of the committee to consider, if there's a worldwide pandemic, who do you want beside you? The answer is uniformly your family. Imagine the moments lost, how many miscarriages were taken alone, how many deaths were felt by yourself, and how many tragedies you had faced without the support of your loved ones. This level of pain, we understand, needed to be worked out, but now that we are here, now that we're preparing for the second wave, we must not allow the mistakes that happened earlier in the year to create further family separations as we approach the second wave.
And how critical does rapid testing and widespread availability to testing play into this?
Rapid testing, rapid availability of testing are just more tools to allow family reunification, whether or not that's a mixture of quarantine, testing, at the border, point of care, anything that we can do to bring families together in a case-by-case basis through broad exemptions is of the utmost importance during the second wave of COVID.
Thank you for everything that you've done, and thank you. My heart is with everybody in your group.